Ho, ho, ho. How's everybody doing? Wednesday, hump day, holidays almost here. You guys all caught up on everything you need? And if not, hope you the least stressful time as you accomplish everything you need. Give yourself a break every now and then. Anyways, good evening, everyone. It's Dr. Joaquin Acosta, your guide and host on this enlightening journey of Know Your Pharmacist. As the CEO of PharmTrue, I'm here to not just bring you information, but inspiration, innovation, and a touch of transformation in the world of healthcare. Tonight, we're diving deep into a spectrum of topics that touch our lives more closely than ever. From the nuanced challenges of alcohol consumption during the festive season to the groundbreaking advancements in digital health technology, we're covering it all, but that's not all. We're also exploring the joyous blend of holiday spirit with the evolving world of cannabis. As a community pharmacist and a passionate advocate for holistic wellness, I understand the importance of staying informed and ahead of the curve. And that's why tonight's segments are carefully curated to offer you the most relevant and engaging insights. We'll analyze the latest trends, discuss the implications of new healthcare policies, and even take a delightful tour into the world of nature and animals. But remember, this isn't just about information, it's about transformation. Each segment is designed to empower you with knowledge, challenge your perspectives, and inspire positive changes in your health and lifestyle. Whether you're a healthcare professional, a patient, or simply someone passionate about wellness, there's something here for you. Join me as we connect the dots between technology, healthcare, and our daily lives. Let's collaborate to build a healthier, happier world, one insight at a time. Together, we'll explore the fascinating interplay of science, nature, and human emotion, all while maximizing our collective potential for wellness and joy. So get ready to engage, learn, and be inspired, guys. This is Know Your Pharmacist, where we bring the best of pharmacy, technology, and holistic health directly to you. So welcome, jumping on into this journey of discovery and empowerment together. First things first, talking about booze. This one's a tip from one of your other local pharmacists here across the country, guys. We're talking about how to deal with alcohol during the holidays in our Pharmacist Frontline segment, brought to you by PharmTrue. We'll let this old pharmacist here share it. I liked her talk here, and we'll talk a little bit about this as well.
Sam, thank you. In today's Ask a Pharmacist segment, holidays mean parties, of course, and that often means alcohol. At one time or another, most adults have had one or two too many and paid the price the next day. So we asked a community pharmacist, what can you do?
Well, I need to state the obvious and say that you can avoid alcoholic beverages altogether. You can also limit yourself to 1 drink per hour with water between drinks. But if you do find yourself with a hangover, there are 3 things that you can do. Number 1 is hydrate. Drink lots of water or try drinks with electrolytes, such as Pedialyte, Smart Water, or Liquid IV Hydration Multiplier. Second is nourish. Try toast and juice to restore your blood sugar levels. If you can handle it, have eggs, which contain an amino acid that helps counteract alcohol's toxicity and nutrients to help your body rebound. And lastly is medicate. Take a pain reliever, but not acetaminophen, because alcohol does increase its toxic effects on the liver. Therefore, try aspirin, ibuprofen, or other NSAIDs for headaches. For an upset stomach, you can try an antacid such as Pepcid, Alka-Seltzer, Tums, or Pepto-Bismol. For diarrhea, you can also take Imodium AD. Also, a reminder to always drink responsibly. If you've been drinking, arrange to get a ride home every time. Last, if drinking in moderation seems impossible, you could be suffering from alcohol use disorder or alcohol addiction. The Substance Abuse and Mental Health Services Administration offers resources and a national helpline at 1-800-662-HELP, which is 4357.
And you can see more Ask a Pharmacist.
Anyways, so good points to consider, right? Sometimes easy to overdo it on the holidays. Eggnog, down here in New Mexico, I think a lot of us like that menudo to wake up in the morning and curb that hangover, guys. Nothing wrong with it, but the one thing, don't drink and drive for sure. And again, it's okay to enjoy during the holidays, right? You probably don't want to make a a daily habit out of the amount of consumption you do, whether food or alcohol or anything else during the holidays. Moderation is the best that you could possibly be doing there. But otherwise, again, if you are going to overdrink, try to pre-hydrate. I would highly recommend Pedialyte or the generic before alcohol consumption. Again, as she did mention, eggs do contain the amino acid acetylcysteine that helps to curb the alcohol effect, or excuse me, acetylcholine, which helps to curb the alcohol effects that next day, get your brain, backfiring on all cylinders. Is actually, a very good one there. Other than that, guys, as she also mentioned, stay off the Tylenol because your liver is going to be upregulated when you're, consuming the alcohol. You don't want to jack up the liver even more and occupy it with processing of, Tylenol, which could offset and hurt the liver over a long period of time, and or mess with other medications that your liver may be processing, right? Which, some of us on chronic pain or chronic medications for our chronic health diseases, definitely have to be very aware of those kinds of things. So, Pharmacist Frontline segment. Enjoy alcohol during the holidays, guys. Try not to overdo it. Perhaps substitute, one night of drinking with one night of cannabis. Perhaps see what happens. People might be gathering multiple nights, so try that one family night cannabis. See if that's a good swap. Maybe not, but always worth suggesting here from Santa's Little Helper. And again, telling you guys, 63% of Americans are going to be incorporating cannabis into their holiday routines. Whether or not they are consuming it in the presence of their other family members as they would alcohol, that's a different story, but worth debating, because I'm telling you, maybe not this year, maybe not next year, but it's eventually going to be a lot more normal than it is even right now, 2 years into it being legal in the state of New Mexico. So all points worth acknowledging as we get to where we get right now. So guys, we're going to move into our tech talk. I like this article coming from the Specialty Pharmacy Continuum, discussing technology-driven monitoring in specialty. So again, this is a very, very important, place and venue for our healthcare. Basically, right? Specialty pharmacy is where all and a big majority of our drug spend go. Like you're talking your tens of thousands of dollars of medication, right? So very, very interesting and very, very, important to see how technology can help lower costs, improve outcomes, especially right when it comes to specialty pharmacy. And talking here, this is the HSSP, right? The Health System Specialty Pharmacies Group. And again, they're facing increased pressure to demonstrate excellence at managing high cost and high risk specialty medications. Accrediting bodies, regulatory agencies, and external financial stakeholders are increasingly interested in the impact of specialty pharmacy services. To engage successfully with the stakeholders, HSSPs need to demonstrate that clinically meaningful endpoints are met for specialties. And, honestly, that's a good point, because, guys, the bulk of our drug spend in terms of, our American healthcare system is going to go towards your brand name medications and then your specialty medications, and your specialty medications being a disproportionate amount, right? So even if you have only one out of every 100 or 200 people that might be on these kinds of drugs, it could literally account for that whole entire, they're holding up that entire amount of drug spend based on, certain kinds of specialty drugs, infusion drugs, right? We're talking cancer, high level HIV, all kinds of things that we do not deal with at our regular level. So your autoimmune, you're not going to see it at your retail pharmacy level very, very much, right? So, what are they going to do? Well, again, first step in incorporating clinical monitoring tools into patient management system is to identify the measurable outcomes. The step is to require, right, having people, the key stakeholders, determining meaningful outcomes. The groups include representation from organizations, leadership, clinical subject matter experts, physicians, advanced practitioners, clinical pharmacists, clinical collaborators affected by the project, end users, informatics, pharmacists, and data analysts. So again, how is it all going to look? Well, Vanderbilt, they have their, approach that they came up with here, and it's a good tool where, again, identifying the people that need to be a part of it, evaluate, redefine, keep reevaluating. They have the good users, all the stakeholders, and a nice little chart here to assess, reassess. But it's very, very, very interesting to see the outcomes that are coming out of it. So here, clinical monitoring outcomes, EHR flow sheets, right? EHR flow sheets to document things like the 25-foot walk test for neurology clinics, or the routine assessment of patient index data 3 survey for inflammatory disease clinics, right? So very, very interesting here. EHR flow sheet, quick actions to allow specialty pharmacists to document work and spend time managing patients who do not fill their prescriptions with VSP. So, a lot of other things there that need to be very tailored, very detailed. And, as we talked about like yesterday, and we were saying the closeout of technology for 2023, right? And where our industry is, and, so on and so forth. Well, what I'm basically stressing here is that it's important to notice here that we have the need for a healthcare system that can basically almost be unified, from the pharmacy side to the healthcare provider side to the hospital side. If everything could be working at a one central database, right, that truly connected somebody's health system, and your health record was you no matter where you went, man, that would be the ultimate connector there. That's probably gonna, I think you'd see it from a government outcome. I think that's probably something that wouldn't be a bad idea to consider there, having some just unified at least. And if you've got a driver's license, why can't we have, right, one self-identifier, right, for your healthcare profile? You shouldn't be 15 different people at one pharmacy, right, because you have 15 different profiles of your name. Like, on top of the fact that, whatever doctor you were with when you were a kid, or whatever doctor you were with when you're, over, just on a one ER visit somewhere. So all of those appointments, all of those visits, all of that health history, it would be a lot better if all of it could talk, and your doctors, your pharmacists, your insurance companies, could all have that single planular view of, the entire scope of it. Anyways, not only am I imploring the fact that the HSSP organization sees here, the need for it at, especially the fact of their high risk, high dollar medication scale. But again, the point taken is that facilities that are doing pen and pencil and paper and books, those ones are the ones that are going to be very, very, far into the past, as soon as we get to those points. But, here in the future, it all needs to get into that computer, and they all need to be able to talk to each other in real time. Like, we're going to see it. We're going to get there. I don't know what you call some unified system like that, but it'd be a good place to get to. So let's talk about holiday consumer trends in 2023 in our Enlightenment Hour. I think it's some fun stuff to talk about. Maybe you don't, but I'll tell you why. I think it's interesting to think about what people want, what people don't want, right? Yes, of course, everybody wants discounts. Everybody and consumers are always on the hunt for deals. Money's always tight. Money feels extra tight. Now maybe versus 2 or 3 years ago when everybody had their recession bucks, right? It doesn't matter. Either way, how are people spending their money? How are you spending your money? Well, again, it's interesting to think that this is like the first year ever that people are actually using a Gen Z things like generative AI to help, doing tech assisted shopping. And that's interesting, right? Where people might use ChatGPT or, Google Bard, right, to help. Hey, well, what do I do to shop for my girlfriend? What do I do to shop for my, mom, right? Anything like that. Those used to be little Google queries right back in the day. And now, you could be talking to your virtual assistants, and maybe you could actually help to get better personalized options detailed to, whatever needs you may be. And, maybe just bouncing it back and forth with the AI and be like, well, I've got a budget of this, and I want to just find something that's, this is what my person in my life is like, so on and so forth. Not a bad idea there. And it's shopping that's never been done before. And I think that's a cool trend there too. Another one, Gen Z flexing the spending muscle, right? So while millennials, many in their peak earning years, still at the top of holiday spending heap, Gen Z consumers 17 to 25 years old currently are on the cusp of expanding theirs. They're about to spend closer to $1,275 on average, 15% more than 2022, and the widest percentage increase of any groups. They like to browse for gift ideas in stores, interestingly enough, 67% versus 58% overall. Social media, 41% versus 31%. Preferring social media for comparison shopping, learning about sustainable companies, and mobile payment is their speed. So, interestingly enough, those of you who may be shopping on the phone, may not be shopping on the phone, it's all interesting to see, where we continue to go. I think that's important to see people, buying their time back as a matter of convenience, using things like delivery and these options that are available that weren't available, years ago, where people just had to go trample each other in the stores. So again, of course, everybody wants deals. People want their home delivery, guys. Tech-enabled convenience, online booking, ability to bypass human agents, and sustainable travel options. This one's interesting to me because on this other side, you also have another group of passionate people who hate self-checkout, so on and so forth. If you're a person who hates self-checkout, let me know. I personally don't, but I'm that guy who can, go whip it over to the self-checkout. I feel fast and good, but I get both sides of the train. But I would also at least say you got to have options for both sides there. So maybe, again, if you don't have somebody that's available, to do your, to take care of somebody who doesn't want self-checkout, then, shame on you, right? If you're just self-checkout, and again, Walmart, notoriously pisses people off for that, but I get it to some degree. Anyways, we won't talk about that anymore. All right, guys, so it was fun today. I'm wearing this because we did the High Horse Cannabis Podcast, episode number 13. Bennett and I busted out some cooking, guys. We had tea time. Me and Bennett made cannabis-infused tea on the podcast. Boom, and you see that little tea kettle there. We made some cozy chamomile tea. It was delicious. We put it down. We used the post material from the Volcano Vaporizer, my favorite machine. We lit up a bag, got some of that post material, put it into the tea kettle there. We added a tablespoon of butter there as well. Let it simmer on low for 14 minutes, 15 minutes after it was boiled, and then add it in the tea, cook the tea for another 5 minutes. Boom, poured it out through the strainer in the cup, as you can see. And it was amazing. It was delicious tea, perfect, cozy afternoon tea for today's, rainy day for sure here in Las Cruces. I'm sure anywhere north of us is probably getting snow. We are close enough to the equator that we could be 70 degrees yesterday and like 40 degrees and cold, rainy today. So, it is what it is in Las Cruces. We all know, but hope everybody goes and checks High Horse, Full Spectrum Podcast, episode number 13. How many of you guys, again, are going down to your Christmas parades, bringing a cannabis-infused treat to pass out to all your friends and family? Maybe you're not, but hey, I'm encouraging you, whether you had the uncle or aunt or dad or mom or whoever that likes the wine or the whiskey, maybe you've got an uncle or aunt or dad or mom that might want a gummy or, some flour or an accessory in the cannabis world that might help their life, like a grinder or whatever. All good things to consider, things you don't have to do and hide about anymore in today's age, right? That's the interesting thing, to debate all this stuff, talk about gift ideas when it comes to cannabis, show you guys how to cook with it, whether it's tea, Viscopitos last week. It should be a normal part of the deal here, right? If you can make alcohol infused, eggnog, and everybody's having a good time, there's no reason you can't make cannabis infused tamales, right? Like, you can do it with anything. It's fun, it's easy. Change up the narrative, guys. It doesn't have to be something you hide behind closed doors and avoid your friends and family to have to consume, right? That's the part that we're trying to change here in the narrative for High Horse Cannabis, writing history, not just reading it, baby. We are the writers. So anyways, moving on to the next community spotlight. Shouting out Las Cruces Museums. So Las Cruces Museums is having their animals encounters over here in they're in downtown Las Cruces. I'm going to share the screen with you right now. Excuse me. So animals encounters. Look at that snake. Hey, right? At the Museum of Nature and Science in 2023 is highlighting a different animal who is native to the Chihuahuan Desert each month. This month we'll be working with one of our favorite residents, Bugsy, from 11 a.m. to noon this Saturday, December 2023 event. And admission to the museum is free. It's open to all ages, featuring the Trans-Pecos rat snake. Did you know that they are one of the calmest snakes of our local desert? Looks freaky to me. Learn more at our animal encounter event. Over the course of the past year, we have showcased 12 animals, with half being living animals from our collection and the other half being represented by taxidermy in the museum. We hope you enjoyed the encounters. Look forward to seeing you next year. Go check it out. Cool event. Take your family. It's free. Go check out the Pecos rat snake. Spooky. All right, last guys, we're talking heart rate check for men. Men's Health Minute before we let you go. Heart disease, leading cause of death for men and women. Data from the Center of Disease Control shows men as 89% suffer sudden cardiac arrests that occur in men. The American Heart Association says taking your pulse is one tool to help get a picture of your health. To perform the test, assume a resting position and place the first two fingers on the area at the base of your wrist of your other hand, right? Count your pulse or the number of beats for 60 seconds, right in there. Normal heart rate should be between 60 and 80. Anything higher, guys, than 80 could potentially signal cardiovascular problems, and you should notify the doctor. Again, self-exam should be done once a month, and these guys are the old school terms. Like, who has Apple Watches now? Like, probably at least, a fair chunk of human beings right now that could actually have their heart rate data delivered to them all the time, every going second. Have you actually shared that with your healthcare provider? Have you looked at it? Are you managing it? Great place to really, really think about those things. And if not, do it the old school way. Just do a little self-check. If you notice that heart rate's going, a little too fast all the time, then something ain't exactly, right? And we got to just get those things addressed. All right. So we are calling it, guys. Hope you guys have a wonderful evening.